Hi, I'm Nadia Hilker, and I'm making this video to apply to the UWGB nursing program. And before I get started, I would just like to say thank you to whoever's taking their time and watching all these videos, because I know that takes a lot of time and effort to do so. And for the first part of this video, I'll be answering the question of why I would like to pursue a career in nursing. And with that being said, ever since I was a young kid, I would really enjoy helping people. My mom would host these events at her parks, and sometimes I would come and volunteer for them. And at this one particular one, it was a water lantern festival. So people of all ages would come with their friends or their family to build their own little water lantern. And then once it got a little darker at night, we would put them in the stream and everyone would line up and watch them flow down. And this is where I came in as the volunteer, as I would stand in the water just to make sure no one's lantern would get stuck on the sides. And when someone's would get stuck, you could just automatically hear the disappointment or the kids crying because their water lantern got stuck. It can't move anymore. And so once I would push it back into the flow of water, you would just automatically hear the excitement or someone saying thank you for what I had done for them. And this just gave me a feeling of accomplishment of oh, I'm helping someone feel better. They're happy, they're thanking me. And this is a feeling that I've strived to get in my other past jobs. I've done a lot of concession jobs, so I've always loved to be at the front, actually communicating and interacting with the customer, asking them how their day is, just trying to put a smile on their face. So I'd always prefer to be the cashier, or the person that actually talked to the customer. And then one summer in junior year of high school, my friend was like, "Oh, we should do this CNA course because it's covered by our high school." So we did that, and it required 2 days of clinicals at Bellin Hospital. And you could just see the patients' excitement when students would walk in. We had our little student ID tags. They'd be like, "Oh, you're learning. Oh, take your time, just learn. I'm so glad that there's more people that want to help." And this just continued to fill my desire for accomplishment and happiness. And so ever since then, I've worked as a CNA for about 2 years now. And I do find myself sometimes telling my patients, "Oh, let me just go grab your nurse." And so this is where I would like to be that person that a lower CNA could grab. I want to be able to offer more to my patients to continue feeling that sense of accomplishment of "Oh, I'm actually helping this person feel better." So that's why I would really like to be a nurse and go to UWGB to do so, because I really want to continue to capture that feeling of achievement and just happiness that I'm actually helping others feel great. For the second portion of my video, I'll be answering question number 2 of describing a significant challenge that happened in my life and how I overcame it, along with what I've learned from it. And so this event for me was only a few months ago. It was late August, early September. I began feeling very nauseous, dizzy. I couldn't see very well with almost constant headaches or migraines every day. And at first, I kind of just brushed it off because I knew I was starting my first semester at college. I might be just nervous or something. And it wasn't until I was admitted to the hospital after going to the ER late at night with blood pressure well over stroke levels. And from there, the doctors did every test they could possibly think of to see why my body was having such a high blood pressure. I went through things like lumbar punctures, echocardiograms, tons of MRIs, and honestly, they still haven't really found why. I am more stable now, but we're still doing checkups, just watching my brain activity, seeing if there's anything why my body would be having such a high blood pressure. But I would like to say I really persevered through that first semester of college because I was in the hospital or just laying in bed, barely able to function for most of that semester. And I'm really proud to say that I even passed through all my classes, my 6 classes, with high honors for that first semester. And I think that's pretty amazing because I wasn't even able to be in class, but I still would take notes, study on my own, do all the assignments and quizzes, and I did it all on time as well, even though I was in the hospital and pretty sick. And a big takeaway from this whole event in my life was that you really can't ignore any type of symptoms. I even have started implementing this in my work as a CNA right now. Any symptom my patient complains of or anything I notice, I'll just automatically go grab vitals, let my nurse know so they can write that down for any future diagnoses. Because I've really learned that you can't ignore anything from like shortness of breath or just headaches or eyesight issues, anything. And I think that's really important for healthcare because any little thing can eventually lead to big things, just like what I went through with the ER and the blood pressure. And so I really do think I have what it takes to be a nurse and go through this whole course, even though it's hard and rigorous, because I've technically been through it in a way. Like I've went through something difficult and was still able to stay up with my school, and I was working as a CNA at the same time. I did both. So I would really like a chance to show what I can do and persevere through the whole nursing program so I can continue working my way up the healthcare ladder. And thank you for watching this video. Thank you for your time.